GERD or gastroesophageal reflux disease is when you have too much exposure of stomach contents to the esophagus. That can feel like burning or like a substernal pain that we call dyspepsia. You can have difficulty swallowing. You can feel like there's something stuck in your chest or your esophagus. There can be painful swallowing. And sometimes you'll have things such as a cough at night, asthma, laryngitis, which can kind of lead to changes in voice. You typically want to see a doctor after about 8 weeks of persistent GERD and failure of over-the-counter medications. After 8 weeks of therapy and still requiring therapy, at that point in time you should be referred to a surgeon for consideration of an anti-reflux operation. These procedures are all done minimally invasively. Patients will come in, we'll do the operation, and they'll go home the following day. Recovery is a subjective experience, so everyone's going to have their own kind of personal journey. I would say usually at about 2 weeks, any sort of lifting restrictions are off. We do talk about dietary restrictions depending on the type of operation you choose. The majority of studies would suggest that quality of life is dramatically improved as compared to the oral medications, and the symptoms are essentially eliminated, leading to that improvement of quality of life. Gastroesophageal reflux symptoms can be quite disabling and, eliminate potential options such as like going out for meals, knowing the amount of pain and discomfort someone's going to suffer. Anything like laying flat on your back, heavy lifting, squatting would, contribute to worsening symptoms. Anything containing caffeine. There's also some things that have higher content of acid, but each person is different and each person is going to probably have their own set of specific trigger foods. BMI over 35, most patients should be considered for a Roux-en-Y gastric bypass. That would be the most effective and long-term option.